no matter what your age is, somewhere here is where you are. 18 or older is LASIK surgery. 45 older, 3D foveal lens surgery and 3D laser camera. And 60 older, cataract surgery. And we're currently the only center in the state offering these 3D laser procedures. So this is a picture of an eye. You know, the front cover of your eye is called cornea. Cornea is where astigmatism resides. What is astigmatism? You heard about this term all the time, right? Astigmatism simply means your cornea, the front cover of your eye is shaped like American football rather than basketball. That's it. So next time somebody says you got astigmatism, simply means you got football eyes. And the correction of astigmatism is simply using laser to shape your football into basketball to improve your distance vision. That's correction of astigmatism. What is that procedure called? Using laser to shape your football into basketball so you can see distance better. What is that procedure called? LASIK. So that's the first procedure, LASIK. LASIK goes from 18 to 60. And in the Y form, that on the calendar you can pick Monday, Wednesday, but also we perform LASIK surgery on Fridays. So you can pick Friday for same-day evaluation surgery. So what's the latest on LASIK? The latest technology is 3D LASIK, the digital. And we're currently the only center in the state that performs 3D LASIK and also the only center using laser for 100% of LASIK procedures. I actually introduced the laser to the state 15 years ago. I boxed up all my blades and have never touched a blade ever since. But here's the amazing thing. So we've been performing 100% laser for 15 years. I've done about 55,000 procedures, including over 4,000 doctors and all of the patients, laser. But the amazing thing is today, if you can call laser center, you can check and say, almost all other centers are still using blade, at least for some patients. You know, you heard Scott Boltzmann talk about it. He did the investigation and he wanted to get a laser. Now here's an interesting question. Why do you think a technology which is 15 years out of date, riskier, not as good, is still available in almost all other centers today? The answer is cost. Because it's cheaper. But my most important take-home message for all of you today is when it comes to your eyesight for the rest of your life, irreversibly, a procedure. Either do it right or do not do it at all. That's the most important take-home message. It makes no sense to intentionally choose an older technology to save some money for your own eyesight for the rest of your life. In fact, if I were a patient, I would be a little bit worried. You know, if I call a laser center and say, well, I know you have laser, but I want to use a blade. Can you still use a blade? They say, oh yeah, if you want. We can still use the blade. We still use the blade for some of our patients. I would be worried because that means the center, the surgeon is still cutting corners. The last thing you want is someone still cuts corners on the technology that determines the quality of your eyesight for the rest of your life. Don't cut the corners. The latest technology is 3D LASIK. You know, all doctors perform surgery, myself included, we use a microscope. You know, I like to think I'm reasonably good, been doing it for a while. And do you want your surgery, your eyes underneath the laser, to be exclusively depends on the doctor's eyeballing? What if the doctor is distracted a little bit in the middle of your surgery, right? Your eyeball is underneath the laser. Your eyesight for the rest of your life is on the line. So what's a better way of doing it? Today we got the computer, digitalization, all the technologies. So working with the company, we were the first to develop this 3D LASIK system. LASIK is a digital imaging system, real-time. Image your eye and digitally enhance 100 times and digitally position. So the difference between 3D LASIK, this is what we do, and the non-3D LASIK, which is everybody else, is the difference between digital camera like iPhone and the non-digital camera, which is 35mm film camera. For those of us in the audience a little bit older, like me, do you remember that we used to take a picture and go to Walgreens all the time? But now we no longer do that. Our behavior have changed. We take a little digital picture and store in the computer. Digital is better. more consistent, more reliable, better vision, and safer.
Well, it's been 20 years since eye surgeons first started performing LASIK, a procedure that corrects nearsightedness, farsightedness, and astigmatism. In those 2 decades, the technology that's been used for LASIK hasn't changed much until now. Dr. Wang is the first and only surgeon in Tennessee offering a new 3D LASIK technology. Dr. Wang, it's nice to have you with us today.
Good to see you again, Meryl.
You too. Well, let's talk about 3D LASIK. How is that different from the traditional LASIK technology?
You know, Meryl, that what drives the modern technology in 21st century is the concept called digitalization. Digitalization lies behind all technology we see with computers, with automations and everything. So in order to improve the precision and accuracy of medical surgery procedures such as LASIK surgery, we are now moving from analog, the older technology, to digital. That is, during LASIK surgery, the surgeon will have a high-definition microsurgical system mounted on the side, capture the image of the eye real-time during surgery, and digitally amplify 100 times bigger.
Wow.
So instead of analog work underneath the microscope with eyeballs very small, the image of the eyeball is digitally enhanced 100 times larger, and then you can digitally control the laser beam position. You can import digitally the preoperative corneal map. So basically it's a digital technology applied to LASIK surgery.
So what's the benefit for patients?
Mainly is precision and safety, because you know, when you come to eye surgery, the main concern people have is that I want to have vision surgery, but I want to have it done safely, precisely. I want to have the best quality vision. And quality vision comes from being precise, being more accurate with the digital technology rather than the analog older technology. So it's better vision and more precise and safer.
A lot of folks, when they're considering LASIK surgery, worry about whether or not it's going to hurt. Is it painful?
The procedure is largely painless, and basically we numb the eye very well. We use what we call all laser technology, so no blade is used, and then add on to this 3D system, 3D LASIK, we now improve the accuracy and precision of the procedure. So essentially it's a painless procedure, rapid visual recovery, and 99% of patients return to work the very next day. We have done about 55,000 procedures, including on over 4,000 doctors, and all these doctors return to work pretty much next day.
Let's talk about that recovery time. Can you see almost instantly afterward?
Yeah. Next day, the day of the procedure, a little bit blurry, you go home and resting, you know, keep eyes closed and listen to music. But next day you have about 90% of vision right away. You can pretty much return to do most of the things you do on the very next day after 3D LASIK.
Wow. How long does it last?
The LASIK has been around for about 22 years worldwide, and so far we found that 99% of those patients who have the LASIK procedure are stable. So we expect to last the majority of our adulthood, and then later on when you get older, you have a cataract or something, that's of course something else. And regarding 3D, we're just very excited. You know, we were the first and currently the only center in Tennessee offering this digital LASIK technology, 3D LASIK.
Is it more expensive to have a 3D LASIK procedure than a traditional LASIK?
A little bit more expensive because it has the entire 3D technology mounted on top of traditional LASIK technology. And but it's for your vision, for your sight, for the rest of your life. You know, it's really worth every penny.
All right. Thank you so much for telling us about it, Dr. Wang. We appreciate it.
You're welcome. It's good to be here again.
All right. We'll find out more online at wangvisioninstitute.com, and we will link that to our website at newschannel5.com.
A lot of people always come and ask me, you know, what's my secret to success? How do I stay happy? How do I stay sane? I say, hell, I ain't sane. Whoever said that?
Then Dolly recognized a certain ballroom dancing eye surgeon in the crowd.
Hello, Dr. Wang. How are you? I just had an appointment with him yesterday. I got the LASIK surgery. That's what turned my hair pink.
Now, Dolly's going to appear on Monday's season opener of Dancing with the Stars, where she's going to sing a song, and that reminds her, of course, of Ming Wang.
He's always tried to get me to dance. He looks at my little legs that has a muscle in the back and says, "Are you a dancer?" I said, "What are you doing looking at my legs?"
Okay, back to the Hall of Fame.
So she said, what's the big deal difference between doctors if you're talking about the same type of surgery? And my answer was, I said, madam, let me ask you a question. Playing golf is the same principle. You throw the rounded ball into a little rounded hole. Same principle of the game. So I said, let me ask you, what's the big deal difference playing golf between you and Tiger Woods? Like everything we do as a human being depends how it is done. You know, even the same game of golf, there's a difference between Tiger Woods and average golfers. Then you say, okay, Dr. Wang, that makes sense. It's for my eyesight for the rest of my life, knowing how much difference there are between different doctors. I want to do my homework right. How can you do your homework objectively? Oh, you may say, I'm going to check my doctors out. Can you go up to your doctor and say, hey, doc, are you any good? That is not objective, but you owe it to yourself to be objective. It's for your eyesight for the rest of your life. So how can you do it objectively? My suggestion is ask objective questions, such as, you ask the doctor, do you have 3D LASIK? That's fair. It's like, do you have digital camera? It's not that you cannot take picture without digital, but digital is better. Second, you say, doctor, are you still using blade, at least for some of your patients? That's a very important question. As I said earlier, we are currently the only center use the digital 3D LASIK and also the only center that uses laser for 100%. Blade is still used in most other centers, at least for some patients. So these are objective questions. In fact, as I said, if a doctor is still using blade, if I were a patient, I would be worried because they're still cutting corners. I don't want doctors cutting any corners on technology that determines the quality of my eyesight for the rest of my life. The last question is very helpful too. You ask your family doctor. You say, doc, if you can do eye surgery, where will you go yourself? As the consensus of medical community, that is objective, that is reliable. Now, we talk about LASIK surgery, work on the cornea, right? How about the condition that called presbyopia, over age 45? We cannot read things up close anymore, right? For the longest time, we have no treatment. LASIK is mainly to improve your distance vision. So when somebody came talk to me, for the longest time, up until about a couple of years ago, said, Dr. Wang, do you have anything for my, I'm getting older, I push things further and further to read. I used to have nothing, LASIK's ready for distance, so I used to tell patients, well, Johnny, you're getting old, your arm's getting shorter, that's all. And I give a name, I say, you got the short arm syndrome. You go to someone else, it's not your eye problem. Now we do have treatment for short arm syndrome. If you have the condition, well, I see many of you laughing. I bet those who are laughing must be under 45 because you don't know what we over 45 are going through. The first procedure, 3D forever lens surgery, help your distance and near vision if you have problem in both. 3D laser camera is mainly for your near. So 3D forever lens surgery, the first one actually captures everything. Treat your nearsightedness, farsightedness, astigmatism, presbyopia, and eliminates the need for future cataract surgery. So let's say you are 55. Let's say you are 52. You say, Dr. Wang, what options do I have? You can have the 3D forever lens surgery now to improve your distant near vision, or you can wait for 30 years until 82 to have your cataract replaced with the lens. But from 52 to 82, there's a certainty of visual deterioration and frustration. So rather than experience the certainty of 30 years of visual deterioration and frustration, why don't we bypass that now? Have the vision fixed. The 3D forever lens surgery can actually restore your focus and hold it there, stop your aging. So the rest of your body may get older, but not your eyes. It's amazing. It sounds too good to be true scientifically, but the technology is here now. It can actually rewind the clock and stop it. So you can have the 3D forever lens surgery now at age 52, or you wait until 82 to have the cataract surgery, have the 3D forever lens implanted then. These are new technology, like high tech. So if the advantage having it down is you can bypass the entire 30 years coming up now of increasing vision deterioration and frustration. But also, think about it. This is like high tech, right? It's like Mercedes-Benz. So the question is whether you should have surgery at 52 or 82 is question basically, do you want to have your Mercedes-Benz at age 52? Or you want to have your Mercedes-Benz when you're age 82? Do you see the wisdom in this approach? So medicine is about early treatment, early diagnosis, so you can enjoy life longer, rather than treating a disease at the end stage. So 3D forever lens surgery is the procedure that with rapid growing popularities now among baby boomers over age 45. 3D laser camera is the latest kid on the block. It's so fast developing technology that this technology was not available even 8 months ago. We were the first one of the first in the country, and still currently the only center in the state offering camera. But it has a requirement you have to be a perfect human being. That means you always have the perfect vision. You're over age 45 now. The only trouble is normal aging. So either perfect naturally or after previous LASIK surgery some years ago. Your distance is fine now, just reading. So if you're a perfect human being, you can have camera because camera can improve your distance and reading vision without compromising your distance. So any perfect human being here, over 45, always have perfect vision, driving without any glasses. The only trouble you have is the reading up close, needing reading glasses. Any perfect human being tonight? 1, 2, 3, 4. Wow, good. One time I asked this question, one gentleman without thinking, he just raised his hand very high. His wife sitting by him was pulled his hand, no, you're not perfect. For these 4 perfect human beings tonight, if you're ever going to consider vision surgery, I will not consider those bigger surgeries like 3D forever surgery for distance and near, and or LASIK surgery for distance, because you don't need help for distance. I will only consider a procedure that can improve your near vision without touching what you have. Let me show you a video for each. One video is 3D forever surgery, and pretty much I'm not going to turn the light back on. I'm going to go into the third video, which is 3D laser camera. Again, most of us is going to go for 3D forever surgery. Now, then you say, is everybody candidate for 3D forever surgery? No. If I take a full measurement of all of you over 45 tonight, only 50% are candidates for 3D forever surgery. The other 50% are not, because 3D forever surgery has lots of measurements. And you have to fit perfectly all 50 criteria in order to qualify. So I'm going to show you a video about 3D forever surgery and 3D laser camera.
And now, this Fox 17 Medical Minute.
As we get older, the lens inside our eyeball gets more rigid. We lose the range of vision. That's why as we get older, we have to push things further and further away to read. That's a condition called presbyopia. So presbyopia is an age-dependent loss of reading ability up close. 3D forever young lens surgery has enabled our 40 to 65-year-olds reduce their dependence on reading glasses.
Once I found out that I thought Dr. Wang was the best person to go to, I came to the Vision Center and literally went through every machine here. So, I mean, it's just a beautiful experience to come here and be able to see well after it's done.
So 3D forever young lens surgery consists of laser lens surgery, laser astigmatism correction, and 3D technology for surgery, and intraoperative wavefront smart eye surgery technology. So now with the 3D forever young lens surgery, when light comes to the eye of a patient with presbyopia, they're able to read things up close once again, restoring their accommodative function.
Really wonderful I had the surgery. I can't express enough how happy I am with it. I am working now, and I can read the blueprints, and just it's just better all the way around.
3D forever young lens surgery has enabled our 40 to 65-year-olds to reduce their dependence on glasses or bifocals. We are proud to be the first center and only center in Tennessee that offers 3D forever young lens surgery.
If it was an emergency and I couldn't find my glasses, that's kind of scary.
How a new surgery performed here in Nashville is allowing baby boomers to give up their readers. You're watching WKRN, Nashville's News 2 at 10.
It's incredible.
How a groundbreaking new eye surgery done right here in Nashville is turning back the clock for people too old for laser vision technology. The story coming up. We're always thinking about the weekend. Thank you, Lisa. A revolutionary step in corrective vision now being performed right here in Nashville addresses sight issue for us baby boomers. It's called the 3D Forever Young Lens Surgery. News 2's Neil Orn sat down with Tennessee's first recipient of the new lenses, and the change in her life is dramatic.
For as long as Sandra Delaney of Mount Juliet can remember, she has struggled with poor vision. Mornings were especially bad.
And I would turn on the light.
You basically are blind. I hate to say it that way, but you can't see. You can see shadows and you can see forms, but If it was an emergency and I couldn't find my glasses, that's kind of scary.
Chained to corrective lenses, this mom and business owner was ready to lose the contacts, and her timing could not have been better.
It's incredible. And it's amazing that technology allows us to do things like this.
3D forever young surgery is for baby boomers. That means for those patients who are 40 to 65, who up until now have been left in the sidelines for laser vision correction technologies. Blink. Good.
With the help of noted eye surgeon Dr. Ming Wang, Sandra is on the road to perfect distance and reading vision after a procedure that sounds almost science fiction.
Basically, my natural lenses that were in my eyes are gone and have been replaced with brand new lenses that'll never go bad. I'll never get cataracts. I'll never have to wear corrective lenses, either for up close or far away. And it's amazing.
The aging part of the eye is the lens.
The Wang Vision 3D Cataract and LASIK Center is the only eye center performing this lens replacement surgery. And even for a man that has had a hand in countless transformations, this technology and the changes it brings to lives is out of the park in sight restoration.
This surgery shows that we can actually do something about it. We can restore the reading, we can rewind the clock. But furthermore, this is the most exciting part. Once we rewind the clock, allow Sandra to regain her reading vision, we can actually stop the clock.
And that's exciting for Sandra, who had a lifetime of poor vision gone in about an hour and a half, and perfect sight will never be a second thought again. You may say she did come up with one drawback.
I can see everything now.
Well, for years, LASIK surgery has given so many people the freedom to see clearly without glasses or contacts. But for those who have had trouble seeing close up due to aging, LASIK wasn't really an option. But now there's a solution for baby boomers who have trouble with close-up vision. Just recently, Christine New became the first person in the state to receive the special 3D laser camera surgery at the Wang Vision 3D Cataract and LASIK Center. This incredible surgery is unlike any that has ever been done before.
I kind of got tired of having to wear reader glasses every time I wanted to eat or read my phone or anything else. And so this opportunity was exceptional for me, and I heard a lot of wonderful things about it and a lot of wonderful things about the doctor. And I'm excited to do this. I'm excited that it was so quick and he was very calming.
So in this 3D laser camera procedure, we implant a small ring into your reading eye, thereby improving your near vision without compromising your distance vision.
Pray the change is a little bit more effective for not having to wear the readers. I've gotten to the habit of using them as my headband because I always needed them. I think the positive change is that I'm not going to have to do that, and I can actually style my hair the way I want to and be able to go about my business without having to worry about having glasses.
So if you are above the age of 45 and you're having trouble seeing close up, be sure to contact the Wang Vision Center to see if you qualify for the 3D laser camera surgery.
It's a surgery that promises to end a common eye problem for those who turn the age of 40. We visited with Dr. Ming Wang today to get a look at a brand new eye procedure. Dr. Wang is the first in the state to perform the 3D laser procedure to correct a condition called presbyopia. That's the ability to focus better while looking at something up close.
If you're over age 40, 45, you have up-close reading difficulty now, we implant a small ring into the cornea of your reading eye, focusing light, thereby improving your up-close reading vision.
Dr. Wang tells us the procedure doesn't compromise distance vision. Along with being the first to perform the procedure in the state, he's also one of the first to perform it in the entire country.
As I said, cornea, the front cover is where LASIK surgery is to improve your distance vision, correct your football into basketball. And the lens at age 45 becomes more rigid, that's presbyopia, that's 3D forever surgery and camera. But what if, as you get older, over age 60, the lens becomes cloudy? What is that condition called? Cataracts. So what's the latest on cataract surgery? Well, you know you have cataracts if you have starburst and halo around incoming car lights, and you need more light to read in the restaurant, and then you're over age 60. This is the most important slide for cataract surgery. most of the doctors today are still using blade for cataract surgery. So they are still waiting for the end stage of disease because blade is a little bit cooler and is not as accurate. So many doctors are still waiting for the ripe and mature, the old criteria. Not anymore for the top surgeons who use laser. We can do surgery a little bit safer, and we can do a little bit earlier. So we like to do lumpectomy, not mastectomy. So if your doctor said, Ms. Jones, you have early cataract, you should wait, maybe you should not wait. Because if your doctor is still using older technologies, he or she is still waiting for end stage of disease. But if you want to have the safer procedure, you should make sure you do your second opinion, find a doctor who utilized the latest technology. We were the first, actually, in the state to introduce laser cataract surgery. So the take-home message is, ripe and mature is old criteria. Just because your doctor asks you to wait, you should maybe seek second opinion to make sure you get the right treatment, use the latest technology. Now you may say, Dr. Wang, wait a minute. You mean different doctors have different opinions? Let me ask you, do you think different golfers playing the same game of golf with different qualities? Of course. Everybody's opinion just depends on his or her knowledge, expertise, training, and experience. So it's a mistake to assume all doctors have the same opinion or have the same skill set. It's just a mistake to assume all golfers playing this golf with the same quality. So the most important thing, take-home message for cataract surgery, so you have your auntie, your uncle, is that most of the doctors are still using blade today. They're still waiting for end stage of disease, ripe and mature.
The first leap forward in laser refractive cataract surgery, Alcon's LensX laser is putting the future in motion. Delivering the accuracy of a femtosecond laser to refractive cataract surgery, the LensX laser is designed to predictably perform many of the most challenging aspects of traditional cataract surgery, with highly reproducible computer precision. Capsulotomy, lens fragmentation, and all corneal incisions are created with image-guided surgeon control. The first femtosecond laser cleared for applications in cataract surgery. Alcon's LensX laser is an image-guided surgical breakthrough. Providing cataract patients with a blade-free, technologically advanced alternative, the LensX laser is leading a new era of refractive cataract surgery innovation. The LensX laser is designed to provide patients with an optimized refractive cataract surgery experience. Featuring real-time imaging and integrated OCT, the LensX laser allows for visualization of the entire anterior segment during docking, planning, and procedure. The patient relaxes as the surgeon utilizes the high-resolution video microscope and live OCT image to gently guide and dock the disposable patient interface to the corneal surface. The large-range OCT rapidly scans the entire anterior segment. This allows each step of the procedure to be easily planned, customized, and executed. Scans of anterior and posterior capsules are efficiently captured, then presented as unrolled real-time images for precise programming. The LensX laser brings a new level of customization to cataract surgery, allowing each procedure to be specifically tailored to patient anatomy and surgeon preference. The video microscope allows the surgeon to use the patient's eye as a visual reference when programming the laser's settings. Featuring an intuitive graphic user interface, a wide range of laser settings can be easily adjusted before and during surgery. These include size, shape, and location of each incision, lens fragmentation, and the depth of cuts. After each cut to be performed has been programmed into the system, the LensX laser foot pedal is depressed and the procedure begins. First, the capsulotomy is performed, creating a precisely centered capsular axis. This is very important, as proper capsulotomy size has been shown to impact the effective lens position, a key parameter in IOL power calculations. Next, the lens is fragmented into easily dissected quadrants for efficient removal with reduced phaco power. Finally, the primary and secondary corneal incisions are created, as well as arcuate incisions. The laser can even perform multi-plane incisions to help promote wound sealing. Leading a new era of innovation in refractive cataract surgery, the LensX laser is putting the future in motion.
His signature cowboy hat and dark sunglasses do more than make Charlie Daniels look cool. They protect his eyes. For years now, the Mount Juliet native and country music legend has been losing his eyesight to cataracts. But today, he's among the first group of patients in Tennessee to undergo a revolutionary new procedure called smart eye surgery to have his sight restored.
Well, now the devil went down to Georgia and he's looking for soul to steal.
Country legend Charlie Daniels is used to performing in the glare of bright lights. In recent years, the 75-year-old entertainer has been losing his sight to cataracts. Today, he's one of the first patients in Middle Tennessee to undergo a revolutionary new procedure called smart eye surgery.
I'm going to get straightened out here and be able to see without glasses for the first time in 68 years.
Dr. Wang is the first cataract surgeon in the state to introduce the smart eye surgery technology. Instead of waiting weeks, this new technique allows a surgeon to customize treatment as needed immediately after the cataract has been removed.
That we can actually do the mid-flight adjustment on the operating table before surgery is finished to test drive, to see how well this particular patient's body, in this case Ms. Daniels' eye, is reacting to the lens implanted.
Charlie had surgery on his left eye 2 days ago.
Well, it's still a little fuzzy, and I see some halos, but that's to be expected.
He had surgery on the right eye Thursday morning. Smart eye technology lets Dr. Wang analyze Charlie's vision and make precise adjustments during the procedure, giving Charlie a faster recovery time.
I'm just looking forward to not having to reach over and pat around on the table for glasses when I get up in the morning to see where I'm going.
Now, Dr. Wang tells us that Charlie's home tonight and doing great, and Charlie says he now has 2 smart eyes. For more on smart eye surgery and to see our complete interview with Charlie, go to our website at WKRN.com.